I think it's really important as oncology nurses to think about the caregiver of the patient. Often we used to just dismiss them and not even think about their needs. So I do use a book from the American Cancer Society specifically for caregivers. There's also another book from the Lung Cancer Research Foundation, caring for a loved one with lung cancer. And so when I first meet the patient and their family member, I have a folder for them and we discuss everything about the patient. And then I turn to the caregiver and say, you are a very important part of your loved one's journey. And I have some items for you too, for you to look at your convenience if you can. And just know that I am here for you as well, because you are very important. Your loved one is going to need you through all this. And then I could kind of also give the caregiver some guidance, like, the patient is going to need you for certain things, but you don't have to be everything to them. But maybe you can help them arrange their bills. Maybe if you're part of a church family, you can have the church members bring in food every day. So things like that, so that the patient doesn't have to worry about those things. But I also want to stress to the caregiver that it's important that they take care of themselves and that they have rest and times away from the patient, because we need them to stay healthy. And you kind of see this relief on their face, because they really feel like they have to do it all and they can't show their emotions. They don't want to cry. I've often had, husbands or wives tell me, well, I have to be strong for him or I have to be strong for her, but I'm really feeling stressed and I don't know how to take care of that. So I think the caregiver is a very important role, and patients definitely need them. And as oncology nurses or anyone working in oncology, we have to be cognizant that the caregiver is taken care of as well. COVID-19 has affected my practice, especially in the early days back in a year ago, March and April, when patients were not allowed to have loved ones even in their consults. So since I always do get involved at a very early time, pretty much when the patient is first diagnosed, the family knows me, whether it's a daughter, a sister, a husband, wife, and they had my phone number and they knew I was available, and they would be waiting out in the parking lot wanting to know what happened, and they'd call me as soon as the patient would come out. They wanted to know what was said, what can we expect, and that just was really, it made you feel like you were doing something, because often nurses felt like, I want to be on the front lines. I want to be helping, with this COVID thing. But as an oncology nurse, I was doing what needed to be done for my patients and their loved ones at the time. They needed me more than ever, because they couldn't ask the questions to the doctor. And they really needed someone to be their support. So yeah, I would definitely say also COVID-19 when patients were in the hospital, and I had one gentleman who was terminal, and he happened to have a stroke in the meantime as well. And so he was combative because he had expressive aphasia, and the wife would call me daily or 3 times a day. She was just so upset. And I had arranged with the manager of the floor, because he would be combative and throw his food. And I told the manager that maybe if we let his wife up, that things would change. I said, I think that he would be much more cooperative. And so we allowed him to visit, the wife to visit from 10 a.m. to 6 p.m. And during that time, he was able to, focus on getting better with his rehab and his stroke and everything. And he didn't have to be restrained, and he wasn't pulling out his lines. So I just really think that the oncology nurse navigator was imperative to family members, caregivers during COVID-19.
Well, during COVID-19, I was actually required to work from home, and I only returned to the hospital 3 weeks ago. So all for a year, all of my contact was via the telephone with all of my patients. And it was very evident that they felt like I was their lifeline. I was the voice of calm and reassurance. And They had fears not just about COVID, but about should they even go into the hospital and to their oncology office to have their infusion done. And I did a lot of reassuring about how careful that either the hospital or the medical oncology group that they were seeing was taking extra precautions in cleaning so that they would be safe and that everyone would be wearing a mask. And that appeared to help a great deal. It's been quite interesting for me with caregivers. They truly want me to be honest with them, and they really want to know what's going on and what are the options for my loved one. Are that they want an honest answer? Are they going to make it or not? So I do find that I am re-educating them from the perspective of what they've already heard from their physician. There are other times that I'm the one that is initiating some of the harder conversation if the patient has just continued to advance with their disease, and maybe initiating that conversation about palliative care or hospice with them, just to try to get them mentally ready for that aspect when they might need to make that decision.